Hi, I'm George Oswald, Dr. George Oswald. I'm standing for election as Deputy to the States of Guernsey in the forthcoming elections. I've been on the island now for nearly 40 years, 34 years of that as a practicing doctor at the front line, initially in the old practice groupings, latterly as part of MSG, of which I was chairman for 2 consecutive terms, as well as being on the management group for that for some years. During that time, I achieved a number of things, including with colleagues establishing the secondary healthcare contract, which means, when one seeks secondary care now, one doesn't have to pay for it at source. In the old days, many people will remember what a threat that was to families' finances, and that was a significant moment of social change when we achieved that. For the last 4 years, I've been a non-voting member on the Health and Social Care Committee. I've enjoyed that experience tremendously. I think I've contributed quite a lot. I participated in several working groups, and one area of particular interest to me, and with which I established a code of practice for conduct, was dealing with the difficult issue of children taken off island for external opinions, and when they come back to the island, how that can be integrated into the local social and healthcare format. I have other issues which I need to discuss. We are in the process now of moving on to phase 2 of the hospital modernisation programme. People will be aware that there was considerable controversy and debate over the overrun of the budget. With a value engineering exercise, we have managed to achieve a result which actually could lead to the building of phase 2A within the budget allocated to it by the states. But we need to ensure, as indeed the value engineering report suggested, that the plans for phase 2A are compatible with what we see as the problems in the future. The original designs for phase 2A were pre-COVID, and it is quite right to have a significant clinical debate at the moment to make sure they're making the right decision. In terms of primary care, we are very fortunate and lucky to have easy access to a well-run and excellent primary care service, but this comes at a cost. Lots of the problems with costing arise around the fee-for-service basis, including the provision of repeat prescriptions. When I ran the diabetic service locally, I established an insulin passport system which allowed people with type 1 diabetes to have access to repeat prescriptions without the need to see their own doctor, provided they were under care by either one of our specialist nurses, by myself, or by the GP himself. I feel this programme could be rolled out to other areas of chronic illness, albeit it would take quite a lot of work and negotiation with the clinicians involved. We have problems with key workers and housing them. It is a crisis, as everybody realises, and the actual progress on producing proper key worker housing has been glacially slow. I'm not clear why. Probably a lot of it comes down to finance and planning, but we need to move on this. And finally, one of my main areas of concern is the mental health of our young people. The Guernsey mental health strategy has been recently published, and I applaud the work that they have achieved, which has gone a long way down the pathway which I wish to explore, which is establishing a mental health champion on HSC to drive forward cross-party working to try and restore the mental health of our young people back to somewhere where they can achieve what they need to achieve and hope to achieve in their future. Which brings me on to education. Education is not my forte, but I think many people will recognise that the system we've ended up with is not one which we perhaps would wish to have had, or not one which was envisaged to come when it was first decided. However, to make a major uproot in education planning or delivery at this particular time is going to involve further disruption of our children's education, and we need to make the best of what we've got. For that, we probably need to get support from people who are experts in education, who can actually look at the way our schools are operating, what they are achieving, and how we can improve things to make things better. In terms of the mental health of the young, clearly schooling also has a role, and media education should form as much a part of the standard curriculum as other parts of education to try and avoid the inequitable and difficult areas that children can be exposed to. Assisted dying is a controversial subject. As a doctor with 34 years experience locally and many years experience in the UK before coming here, I'm more than familiar with the arguments for and against this. I have changed my mind several times on this subject. My professional body, the Royal College of Physicians, has adopted a neutral stance on this issue, which I respect. But if I am elected to be a deputy, then I'm going to have to make my choice. At the moment, on balance, I'm inclined to favour, and indeed I think it's essential, that there should be investment in palliative care services. We have a good palliative care service recently. We've been very fortunate that MSG has managed to appoint a palliative care consultant locally, and I would wish to work with her in deciding how we go about improving palliative care services, such as the need for assisted dying hopefully will regress, albeit it may never go away entirely. I'm not a party member. I contributed to the health debate in the Future Guernsey Manifesto. I was asked to do that and honoured to do that, and I did that with my colleagues, because I think there needs to be a forum of exchange of ideas and a political think tank which all deputies can access and pick and choose the bits they like. Obviously, the Forward Guernsey party members are committed to every single aspect of the Future Guernsey Manifesto. I am not. I would welcome debate on several of the areas they cover, but having said that, there is a very good process where 50 local people of considerable merit have looked at all the difficult issues about the economy, fiscal development, taxation, and education and housing. In terms of housing, we have 4 issues. The problem of supply of land, the problem of finance of the purchase of land, the problem with buyers buying their houses, and the problems of how we house our key workers. There are no simple answers. I like the idea, which the states used to run, of a state's mortgage system, but that was deemed to be non-competitive with commercial offers and has long since died. But we need to seek advice from experts as to how we can handle this issue. It's not a problem peculiar to Guernsey. My own 4 children, well, 2 stepchildren and 2 of my own, are all facing exactly the same issue in disparate parts of Europe, including London, Prague in Czechoslovakia, and here. So it is a problem not unique to Guernsey and facing the Western world, and there is no simple answer. But we need to work at it, because clearly it is a major issue in actually keeping our children on the island or attracting them back once they have gained their qualifications and world experience elsewhere. Finally, I am in favour of consensus government. I know the difficulties of consensus management. Having managed a partnership, and those who have actually managed partnerships will know where I'm coming from on this, but progress can be achieved, albeit somewhat slower than it might be with an executive government. However, one factor about executive government means that an executive government can still make the wrong decision, but act on it and initiate it much quicker than a consensus government might do, and perhaps without the feedback and debate which might make mistakes being made in the future. I think Guernsey in the past has made mistakes. I worry about the ferry service. I think it's running well at the moment, but I wonder how viable the 2 independent companies working on the 2 different routes are and how long they will last. Hopefully they will both last, and we will both see successful ferry services to and fro from both Jersey and Guernsey for the foreseeable futures, but I'm sure I'm not the only one who has worries on this matter. Finally, please choose to vote, and if you do vote, I will be very grateful for your vote. I will try and do my best for the island in the future.